So what she just put up is what I stumbled on. I heard something about it last week and thought I had to have been misunderstanding it.
Really?
Well, really, why would we be paying these places a bonus to do their job? And then I heard it again yesterday and started digging. I also spoke to the director of my son's facility just to make sure I was accurate before I went off on another warpath. And I am. So, I mean, as far as I can tell, and it talks about SNFs can get it and nursing homes. So first of all, I don't even know what the difference would be, because I would think that an SNF and a nursing home are the same thing.
Yeah.
But even, and there's so much other CARES Act money that goes in and out in different ways, and tracing where it all is for long-term care is really difficult. But I really think this is why some of the facilities are keeping us out. Because let's face it, they all swear we're a higher risk than the staff.
I honestly, what first came to my mind is if facilities would use it as a way to incentivize their staff individually, because I think that's the problem. You have, you know, skilled or lovely skilled workers that don't make very much an hour, that on their off time are not being careful, and they're bringing the infection in the facility. I mean, the residents aren't bringing it and they haven't been anywhere. So if it was actually used to incentivize the staff somehow, because my mom's facility, they've been testing now for almost 12 weeks. Every week they test. Yeah. Now this week they do have residents positive, but they had been having like one staff member every week. So we never got anywhere. Right. We're never going to get 14 days because we always have at least one staff member.
Well, we're the same place, and we test twice a week because of our positivity rate. They just put us back in outbreak status because we now have 2 residents again.
Yeah, well, we have 6 as of yesterday. So wow. It's going to be, I don't know if they're back to having, I mean, my mom, when they had the doors closed and her, you know, everybody treating the residents like they all had cooties, she didn't do well at all. I don't know if it was because of that or, you know, some medical event, but so I don't know. But
you know what? I think it's a combination. And so there's a doctor named Dr. Wasserman, and he's a geriatric specialist. And I'm in the process of trying to track him down. I've been told he's more than willing to work with groups, but he's very well known and very outspoken. And a lot of his focus, I've been told, was trying to convince facilities and CMS and everyone else why they need to be looking at the patient and the family and going in that family-centered care avenue that I keep trying to push. So because he's so well known and because I have experience with the family-centered care stuff, I'm trying to track him down and see if there's any way to get him to help us in another manner that maybe we haven't thought of. Or, you know, I also know that one of his big studies that he did in St. Louis. So he's very familiar with where, you know, our area too. So I don't know.
I thought the news coverage this week was great. I mean, I was very positive this week. I'm not sure where it's getting us. I don't know where IDPH is at, but unfortunately there's so much in the whole state right now that this is falling further and further down their list of important things. I mean, which I guess in some ways maybe it has to. I don't know, but
no, it doesn't. Until we get to at least Thursday of next week, anything we're doing in circles, really. Until we're past the election, it's useless, which is why I've been trying to do things like compile this kind of data from this that I found and look at it and say, how do we word this for when we make round 2 of an attack towards our elected officials? Hey, Fran, will you do me a favor and pull up Illinois ACLU page.
Sure.
I had 7 hours to sit at the hospital the other day while a friend of mine was having a procedure done. So I did a lot of research while I was sitting there. The ACLU's complaint per se is much easier than OCRs.
Mm.
I mean, literally, I did it on my phone in less than 10 minutes. Because when you go into it and you file a complaint, all
Yeah,
they
I mean-
want is like a summary, and they tell you basically one page of what the issue is and how does it affect your loved one, and others. Because the ACLU only normally, for the most part, goes after cases that will change the lives of lots of people.
Mm.
Okay, I dropped the link
Yep.
for that earlier document into the chat, and I'll drop the link for this, where we are right
So-
there, in the chat as well.
But they say, first of all, they say they try to get back to people within 2 weeks, which would far exceed anything the OCR can do. But I'm wondering if, all of us, and we can get 10, 12 other people to submit a quick complaint saying, this is my issue, plus the holidays are coming. I'm being told if I take my loved one out, they have to quarantine. They're not letting us in, a quick overview. Because it's done state by state for how they submit things and how they fight it. I'm wondering if we can get enough attention in front of them to get somebody to try to help us.
I have a question though, reading this. It says, we do not practice criminal law or generally take cases where rights have been violated by a private entity. So wouldn't,
But we're saying that the government is doing this.
State.
IDPH is our.
IDPH. And what I put in, just like I do everywhere else, in turn, they are forcing our facilities
yeah,
to violate, okay? Because once we get a judgment somewhere, taking that right away from CMS, the state health departments, all the rest, the facilities are gonna have to just give up. They are not gonna be able to keep stepping on rights because they'll be the next one. And for them, it would be a private lawsuit, and they're not gonna wanna deal with the attorney's fees and getting fined. Kind of like the case in Connecticut, with the support person in the hospitals. Within days of that settling, it went across the whole country that places were putting that rule in place. Does that make sense?
What are you talking about?
So there's Illinois put it in place too, that if one of our loved ones goes to a hospital or a doctor's office that normally won't allow visitors, as long as they have a cognitive, intellectual, or developmental disability, and even physically, if they can't get in and out on their own, that the hospital has to allow a support person with them 24 hours a day. And the best example I can give you guys right now, like where, the majority of you guys, your parents all have dementia. My stepdad's in the ICU in Phoenix right now. And because none of his is cognitive or anything else, they're only allowing my sister in up to 3 hours a day. But if it was because she was, all the rest, then they would have to allow her 24-hour day access.
It's the facilities that are keeping people out. It's
Correct.
not IDPH. It's the facilities.
Well, it's both. So Bruce, what we were talking about before you came in is, I found out yesterday that facilities can actually earn bonuses based on how much below the county positivity rate they can keep their positivity rate.
I saw that this morning. 254 facilities in Illinois are getting $17,000 a piece for what?
Oh, see, I hadn't even seen that on the news. I just saw it. I found this online yesterday after hearing about it from the Illinois Healthcare Association.
On consumer, what is that? The consumer,
Consumer Voice?
yeah, they have that listed on an article on there about that. And you can click on the link and it takes you to all the
Okay.
nurses in the United States and how many are getting a bonus. So 254 in Illinois are getting $17,000 a piece.
I would say $17,000 in their mind, and in some sense you can't blame them, would be justification of, ooh, if we keep these families out, maybe we can get, keep our numbers down and get extra money coming in.
Yep.
So,
I read this morning that's in a lot of the facilities of people on here. The COVID is
yeah.
with 3 or 4 staff members and some residents now, which is totally ridiculous. The people brought it in. I'm really irritated about that because it's not right. That's why I wrote my article on my gripe on before about the legal murder. I sent that to CMS by accident, and they want to do an investigation, but I don't know when they're going to do it. They haven't responded back. So they're going to come in here at some point.
So yeah, that's what I was referencing for, is the support person anywhere we, in public. And even like with my son, when we go places and they're all like, oh, you only allowed one person. I'm like, he's a 2-person transfer and his facility requires that the second person stay with me. And so far, nobody's argued that point with me once I go there. And
Does anybody know, at what point can they say that the resident can't leave the facility? Like if they're in what's considered an outbreak status, which I think, Carrie, you mentioned your son's facility is now, can they deny you going out for a medical appointment if it's considered essential?
I would say no.
Yeah, I don't think so.
Now, I know my son's facility, first of all, the doctor's offices are all calling, doing that 24-hour ahead screening.
Mm-hmm.
They will tell them that the facility is in outbreak status, but they also tell them, like in my son's case right now, it's not anywhere near his side. It's in a whole different part of the building. So, and I'm lucky that the person who makes those calls for my son's facility is very protective of making sure my son gets to his appointments. But there's some doctors too that are refusing to see patients if they're coming out of the facility that's in outbreak status. Or doctors that are in a county with high positivity too.
Mm-hmm. So where the outbreak is in your son's facility, because my mom's facility, they're refusing to tell you if it's her hallway, like the 6 people.
Nope. I get a text that says, like yesterday's text, and I knew about it before getting it only because I'd been on the phone with the director. Says that they have 2 new cases and they are on the S&F side of the building. And that's all they usually tell us is which side, because one side is the S&F and one's the DD side.
Okay.
But
if it was in the DD side, you wouldn't know, like, is that all one hallway? Is that all shared staff, one hallway, or?
it's actually a square.
Mm-hmm.
When we had the first outbreak, and it was 17 residents over there that had it in the square, they told me that it was in the one hall and it was very contained.
Mm-hmm.
Any facility that tells you that, ooh, we can't tell you what hall it's in or what part of the building, that's not a HIPAA violation.
That's kind of what I think too, but unfortunately the director won't answer my emails unless I go to corporate. I can go to corporate COO, but they won't answer. They won't respond.
Who was it that I was telling? I don't even remember. especially if they're not answering your emails or responding to them, start copying the corporate, start copying your ombudsman, because that's the only way we're going to get these people held accountable.
Mm-hmm.
So who's having any luck with the new guidelines getting anywhere? Anybody?
Not with COVID happening, not with cases, prevalent in the facility. That's just discouraging. Yeah.
Have you guys actually asked for compassionate care to see what they'll tell you?
I've asked for compassionate care because my mom lost 10 pounds,
Mm-hmm.
actually almost 15 now, and they told me, no, it's only allowed at end of life. So I've gone to the ombudsman, but as I said last week, he did answer me the first day, but now this is day 4 and he hasn't answered my response to his questions. So I've called and left a voicemail and I've emailed him again. But, I just haven't had real good luck there.
For just end of life. I'm pulling up that document right now.
And that's the problem. Places are misinterpreting the way that's being read. That is supposed to read essentially the same way CMS's guideline reads.
Mm-hmm.
If you've gotten nowhere, so when you asked your mom's facility for it, did you ask it in writing or did you ask it in?
I emailed it. Yeah,
Okay.
I have it in writing because conversation, I don't want to do it in conversation.
Perfect. So I would do another attempt at it and explain to them very clearly that this says compassionate care is not just for end of life.
It's right here in the first bullet point.
Right.
Mm-hmm.
And to make them understand that this is for more, because I obviously we're in a SNP, in a skilled nursing, so ours is a little different, but not the definition of compassionate care. And even yesterday, when they told me, we were back in outbreak status, they said, I still can come.
Okay.
And right there, other cases may be considered, including a resident whose health status has sharply declined, or, a family member or friend has passed away. But take them that and take the wording off the CMS and remind them that IDPH said, basically this is following CMS's guidance.
Yeah.
Because there's a ton of places that I'm hearing that are trying to interpret that away from CMS's guidance to block compassionate care.
Mm-hmm.
I sent my dad's physician a message through the medical portal and asked for him to help with the compassionate care visit. He was going to reach out to my dad's facility, and I haven't heard, as of yesterday, I have not heard anything. So I'm thinking, if you can get your physician involved, maybe a physician ombudsman, I don't know.
Right. And even better if you can get them to do it in writing. Is Fran still in here? Okay, are you okay if I explain to them kind of how the doctor wrote things the other day?
Yeah, sure.
Yeah, okay. So like Fran's doctor, for her son, wrote that she needed to be actively involved in his physical grocery shopping and his meal planning because he's gained so much weight and having other issues. Even without coming right out and saying he must be with her, that, is going to put A and B to equal C. So I think we have to give it everything in writing that we can. And we have to connect the dots for them because they're not willing to. I know yesterday, Julie and I were both on Illinois Healthcare's Wednesday Facebook Live. Their answer was, in regards to essential caregivers, that the state still says they're working on it.
Yeah, I asked the question in the chat if they knew when the program was going to be implemented, and their answer was, well, it took them 2 months to get the revised guidelines out. So she's like, well, it's been a month, so maybe we're looking at another one. So just discouraging.
Very much so.
So I have a question. So you said pretty much we're like kind of marking time till the elections are over.
Yeah.
So, okay, so the elections are going to be over. What is our plan then?
So, well, our plan is hopefully that everybody will go do an ACL complaint because that's so quick and easy. I know Peggy talked about wanting to go back to the Capitol, which is a wonderful idea, but we need to put it as a plan A and a plan B because like Charlie and
Terry.
Terry, thank you. As Charlie and Terry said to me, if they're not back in session on November 17th, it will do us no good to go to the Capitol but to freeze our butts off.
Right.
I mean, we can work on a plan to do it just in case. He did say if they don't go back in November, that they would not go back then until January, and it would be a total lame duck when they go back in January until the new representatives and senators are sworn in. But even if they're there for lame duck and they see us a week before they're doing the real stuff, start the real stuff, it could help.
Our supporters have we been tracking which one of our supporters are up for re-election? Because I guess that's something we could do. I wouldn't be exposure, but just work we could do is track who is, where our supporters are and where things have changed.
The two that I know for sure, I mean, I know Charlie Myers is up for re-election, and I know that Terry is running. She's a state rep now, but she's running for state senator, and she's running unopposed. And those two obviously will spearhead. Julie's the senator that Julie knows that's willing to help us. Is she up for election, Julie? Re-election? No.
No, she's not up for re-election. Emily just posted though that in the chat that she has a call coming up with Senator. I'll have to go back to the chat.
It says Julie Morrison. I see it.
Yes. So that's good. Yeah, no,
Right.
Jill Tracy is not up for re-election. So.
Right. The other thing is, Fran has some video of her son from his perspective of what things have been like. I have a little bit from my son now. I did an interview with Bruce the other day from when we were talking about this idea with Stephen last week. I have an interview that I'm going to do with a lady down in Southern Illinois on Tuesday who just took her mom out of memory care and is going to keep her home as long as she can either financially or mentally deal with it because she couldn't deal with her mom being so isolated.
And also even if it's a phone conversation you're having or a video, if you just want to record it and then you can share it that way. Because we can do voiceovers, or I can take the audio of it, and if you send pictures, we can use whatever.
My goal would be that, within a week or so after the election, that we've managed to put enough of these together from other people to send them to the elected officials saying, here, listen to this. This is why we're asking you to help us. Because it's going to be a whole lot more poignant coming from the residents than it is coming from us.
And don't worry if your loved one can't communicate clearly, because they're still communicating.
Right. One of the ladies from Essential Caregivers did it with her dad for us, and for like a 30-minute FaceTime call. From what I've been told, Fran's seen it, I haven't seen it yet, that he almost doesn't even realize she's there, but it's still, what is this like from both people? I have another lady that I'm hoping that she's first thought she would be able to do it with her husband, because she also just brought him home, and she said he won't be able to, but she might just do it with me of, why did I bring him home? And I do know he has to go back at some point, but what am I going to do in the meantime? Because I think we need to be able to show as much in every different direction as possible. So, even Julie, like when you pick your dad up and take him to go get a shake and stuff, even if you just turn your phone on and kind of record random questions with him, trying to, prompt him to tell you about his day or what's it like at night or anything.
Okay.
This is going to be a long shot. It's going to be a very interesting video when we're done, but I don't know what else. We've tried everything. What else can we do besides giving it to them in the residents' words?
I have a question. Somewhere, now I don't remember where I heard it. I think it was the reporter describing that they're actually putting on death certificates that people are, dying of isolation and something. I couldn't remember the exact quote, but I've been spreading it around.
Yes, there's lots of places that are putting failure to thrive and isolation as reasons for death. And they're putting like COVID, COVID related something.
Yeah, but are they still getting money if they say COVID? I thought that's why a lot of places are saying COVID.
So, hey, Stephen, do you know if there's any accuracy to that, or Emily? All the rumors that places are getting paid more for the number of COVID deaths?
I have not heard of anything, no.
Okay. I mean, obviously, I just found where they can earn a cent of money for lack of deaths. So I'm still not sure that that other one is accurate.
Or maybe it's just for hospitals, because I know there's also, isn't there like a issue where people say, are they really dying in the nursing home or, the facility, or is it in the hospital, or they want to get them to the hospital? I don't know. So then
Right. Well, I know I just read somewhere as I was scanning through all that stuff this morning that like there's an $80 one-time payment or something when they admit somebody with COVID, or so why? And part of it is they're trying to do it, I understand, for the hospitals and stuff to make it so COVID isn't financially ruining people, but it's doing it anyway. But there should be no reason to incentivize anybody. Because then, we all wonder, are the numbers true? Or are they padding numbers?
Hey, Steve, I have a question for you. With these new guidelines that have just recently come out, have you had better access getting into the facilities? Or are they still keeping you out?
So my restriction was from the state ombudsman, not from the nursing homes themselves.
Okay.
I actually had to, like, when I was going and trying to do window visits, I had a few nursing homes that would try to invite me in, or they would have a sign on the door, no one but these people, and I was halfway down on the list, and I had to say, I can't come in, I'm not allowed. So no, I haven't, I've had one place that's put up a little bit of resistance, but it's not a big deal at the end of the day. I'll be able to get in regardless, but no difference for me.
Okay.
Thank you.
Yeah, I sent Kelly a very long email the other night, Stephen, but I haven't heard from her.
She's seen your email, and she's
And
going.
think I'm crazy?
No, we had a call yesterday, and she's gonna try. I know she's got a busy schedule, but she's gonna try and reach out to you within the next week.
Okay, that's fine. I just, at this point, guys, I'm reaching for anybody and everybody. If I have an email address or a phone number, I'm calling them, I'm blowing them up, because I don't know what else to do for us. And part of it's my own guilt, because I feel guilty because I am seeing my son and you guys aren't getting what you need.
Yeah, but that, as we know, I'm seeing my mom too now, the compassionate care, but we know the shoe can drop at any time. That's how I feel.
I guess I'm a little unclear. You talked about a video and wait until after the election, but like Fran said, what is our concrete steps?
So
we talked about the call to action document. I thought we were all going to send it to our individual legislators.
Well, let me follow back with Senator Tracy on that, because of the elections, we just and she said she wanted to help us fine tune that some. Because of the elections, we've just left, at recommendation of a few of the ones that we were working closer with, we've left them all alone. Because like they said, until after they get even if they're not up for re-election, they're helping somebody else. And they very clearly told me, until we get past the election, anything we ask for or try to do is probably not going to happen.
Okay, because for my conversation with Mike Murphy, who is my rep here, and he said, talked about getting, working on some kind of the wording of a legislative document and stuff like that, and getting kind of identifying the supporters within the legislature, and then also identifying those that are against it, so you can work out the language so that once they do get, even if they are in lame duck January, that they can work through some of their process. So when they do get, so I don't think we necessarily really need to wait until
like I said, let me follow up with Senator Tracy because she's the one who said she would take it to the floor. You know, she would take it to the Senate, and Terry Bryant and Charlie Myers have said they would co-sponsor in the House.
Yeah, because Mike told me the same thing. So, I mean, I think we need to work to connect those people. And
That's
I think
fine.
we could do that now if we had a means to do it. But it feels like we're scattered all over the place right now, to me.
I'm not going to disagree with you. I mean, I know we have a list of people that we know we've been in contact with. Is Mike Myers on that list?
Keep talking while I do this.
You mean,
No, you're fine.
do you mean Mike Murphy? Is
Mike Murphy, sorry. Yes, I'm sorry.
Yeah. Okay.
Yeah. And maybe just to be sure, Tammy, why don't you email Fran his contact information to add to our list?
Okay. And then speaking of lists, are we going to share that list of how did you get along?
I shared the people that responded back and said that they didn't, of the friends and family. I did share it in the Facebook page under files of and it's a link to the Google of the emails that of those that said they don't mind. I did have people say, no, I don't want it shared.
Okay.
The senators, the ombudsman, those are just in there. The ombudsman are in there under their own PDF, and the senators are just, I believe, well, I haven't put it in there. I can't. It's just the link to the government page, and that's how I get all their information.
Mm-hmm.
Is that to what you were referring?
Yeah, I was talking about the list of this group.
Okay, I'm going in there.
I'm sorry, I hadn't looked in the files for a week or two.
Do we have any talking points just like that I can use on Monday that you want me to just cover with Senator Morris? Pardon?
I will send you some.
Okay, great. Because I have a meeting with her over the phone on Monday to discuss other things. So I wanted to bring this up as well.
That's fine.
There is that document on the Facebook page too in files, right?
Right.
I'll look that up. Yeah.
But part of that, even now, I think as we're talking, because the one thing I keep hearing from anybody I talk to is, well, IGPA just said they gave you guys new guidelines. It's supposed to be a whole lot better. No. If they give us a bunch of 20 pages of fluff. And I think that's the most important thing that we can explain to anybody. Because these new guidelines have done nothing to help our loved ones.
Well, and I think it's also, unless you're in that experience, you don't know what it really is like. I mean, unless you're a family member going to visit or knowing how the facility works, I ran facilities for many years. My friends had no idea what I did on a daily basis or how complex it was or what guidelines I had to follow. So, I think a lot of people just don't know. They're uneducated. So it's hard for them to understand too.
Right.
Well, I think again, like what I think is like, we still need to like stay on track with what, again, Caregivers for Compromise is, which is asking for an essential caregiver. I think the guidelines can say whatever they want, but there's nothing in there about essential caregivers, which is what we're, trying to get at. And
I agree, Peggy. And as much as it feels like nothing's really happening, I think the news story, we just need to keep on those news stories, and it's educating the public, and eventually maybe that'll help,
So I know from speaking with Jordan that you connected me with, Tammy.
Yeah.
She's very interested. She wants to keep going, which is why she spoke with Fran and with Nancy the other day. Her per se issue, and I'm hearing this from the same thing with the lady from the Belleville News Democrat, is unless we can give them something new about this story, a new perspective, a new avenue to chase, they're not going to be given the screen time or the space in their paper to be able to do more.
Yeah.
So that's part of and I agree, this is all about getting essential caregivers. but we have to show them different ways, I guess, to put it.
Well, I'll email Jordan today with this whole thing, the consumer voice, after I look at that, just to say that, it does appear that there's an incentive to keep us out.
Right, I emailed her that last night too. I emailed her the one from HHS.
But a list of who's involved, and then I'll include the email for the COO of my mom's corporate, and because I thought maybe he was going to be on this call. He's asked me for the link, so he can add his perspective to that. To me, that would be a new
Right.
take on the whole thing.
Right.
I
I
would
don't know if anybody saw the post on the national page from the lady from Inside Edition that she posted yesterday.
Mm-mm.
Mm-mm.
So what she was asking for, I think she's having a very hard time finding. She wants to know of any facilities that are planning something either creative or finding a way to involve the families in Thanksgiving with the residents, even though we're under lockdowns and quarantines. And I'm like, you're going to be hard pressed to find it. You and I both, we all know the facilities aren't going to do any, they can't at the moment, the majority. I gave her the name of the facility my husband's grandmother's in Pennsylvania, because they are one of the few places I know will try. And it was a way to get my foot in the door with her, because she's national media. So I also shared this incentive with her and, all the rest of it, because any way we're getting any media right now, we need to take.
Will you send me her email, because I'm trying to get my mom's facility to have like a family decorating day similar to the parade, summertime parade, car parades, to where we would go and help put up Christmas lights. So from every window you see a lighted Christmas tree outside and stuff like that, maybe more than they've ever had before, because we can't, normally obviously we'd go in the room and put up a Christmas tree for them and stuff like that. So I'm trying to get them to realize making it a family event gives us an opportunity to feel like we're giving something, and we all need that. We need
Actually,
that right
Tammy,
now.
that's a fabulous idea. I can tell you from spending too many Christmases in the intensive care unit with my son, anything, and we all know what the inside of the facilities are like, but doing it from the outside in is going to help the facility, help the residents.
Right.
It's also going to help the community.
Right. Well, I have a suggestion too. If Tammy, if you want to also reach out to, because my mom's facility just did this, which it was so nice, is one of the local youth groups at a church. They decorated pumpkins, and they delivered them to my mom's facility.
Mm-hmm.
So every resident got a really cute, like painted, decorated pumpkin. And my mom was so thrilled about it. So even to reach out to local churches and see if there's something they're willing to do, their youth groups. Because they're still, doing things even with COVID. So
yeah,
you might want to get, your local churches involved too, if they're willing to.
And the advantage, any of that also is a good opportunity to hopefully draw media.
Right. That's kind of what I'm hoping. I'm waiting to hear back from them. I'm afraid what they're going to do is say, well, we're going to put up these decorations, and that's not the point. That's not all of my point. I want my mom to see the lighted tree, but I also want to feel like I'm giving something to her.
Right.
So just counter with, I'm glad you're going to put up the decorations, and we would like to, as a family and friends and community, also decorate in addition to whatever you're going to do.
That's what I've been telling him. So we'll see. It's
And Peggy, that's a great idea to mention it to churches and youth
Right.
groups. I know a lot of organizations are looking for ways to help, because to help creatively, socially distance, whatever, they are still community minded and want to do outreach, and so they're looking for those opportunities.
Correct.
The other thing that I saw at my grandma's facility was that people made like those yard signs, like the little ones, and it had like "We love you, Grandma," and then it had all their names, and put it outside everyone's window, so you could at least look outside and remind you know, these kind thoughts, or people are thinking of you. And they looked very nice. And some of the facilities weren't willing to let families do it, but my grandma's facility let people put signs outside their windows that said, "Grandma, we love you, love all the grandkids," or a picture, or, you know, something motivating.
Mhm.
Even a happy holidays or Merry Christmas, you guys could put outside too.
Right.
As far as a new angle, wouldn't next week with the election be significant? I mean, because, you know, a lot of the people in the our facilities are not going to be able to vote. And you could argue maybe somebody with extreme dementia shouldn't be, but a lot of our loved ones are mentally still ethically able to vote. And so what I had read is that staff is not able to legally help somebody with the absentee ballot. And so, but how would we, if we're not able to get in there and go into our loved ones' rooms, we don't know, did they actually receive the absentee ballot? If this was their first time voting absentee, would they have known how to apply for one?
I asked that question a couple months ago of my mom, because I was going to work for my mother-in-law because she'd done it that way before, and they told me that the activities department does that, and I confirmed with them a couple weeks ago at a care meeting that they were still on track to do that. So the part about them not being able to fill it out, that was in a different state, I believe. They did not mention that to me when I've asked them both times about it.
Right. And the activities
So I know some
department,
state, I think it was Connecticut or something, because I read a news article about that, about the staff not being able to help them, but it was not in Illinois. So I don't know.
Stephen, what do you know?
I spoke with a, can everyone hear me?
Yeah.
Okay. I spoke with the Adams County clerk where I'm at. Gosh, it was a few weeks ago. And most nursing home residents were already voting absentee. So that's, I mean, it's new for people outside of the nursing homes, for, you know, many people, but for nursing homes, it's nothing new. The staff are able to help a little bit. What a lot of places will do is if the person can't physically see the ballot, the staff will read the options, and then they are required to mark whichever box, whichever circle the resident wants them to circle, and then they have to sign a affidavit saying that, you know, I'm the person who helped this individual, and I filled it out per their wishes, and it's a class 4 felony if they lie on that. Which, I mean, arguably, you could say, well, how are you going to know if this person lied on this application, this ballot? My counterpoint would be, if you've got, say, all of the votes in a nursing home, or, you know, 90% of the votes in a nursing home going to one candidate, that would raise red flags, I think, for a county clerk to investigate more. But that's my 2 cents on the last part. Basically, they can read the ballot and fill in the dot they're told to fill in.
Well, and like I said, I know the activities director helped my son do his, because I was waiting for them to tell me that it was there so I could help him. And he told me the other day that Crystal had helped him. So
She has done that for years.
right. So you know, and some of that has been covered by the media. You know, I actually probably have seen more this year than ever because of COVID too. I just really wish, and I don't know, I mean, Tammy's idea is wonderful because it is a whole new, what is going to happen. And I think we're going to see a lot of it all over the country on the media of what the facilities are or are not doing for the holidays. So even if it's using our contacts, using Jordan, using people we do know that have spoke with us and are willing to work with us. I'm trying to get them, we still don't have our essential caregivers. So we're trying to do this, but we need to make sure that the world understands we're not inside. And this is why we're still doing it this way. So, trying to use it to tie back. Does that make sense?
Mhm.
Does Jordan have relationships with people in Chicago?
I can ask her. I know from the last conversation I had with her, she's trying to convince the powers that be at her station to start looking at the civil rights issues of this and going after the legal avenue. So maybe if I ask her, especially if she can pair with somebody up in Chicago through their networks of how is it affecting upstate and downstate both, and are there any differences or anything else, and see what she comes up with. And after that, all we keep being creative and chasing. I mean, do we tentatively want to say we're going to try to go to the Capitol on the 17th based off of what they're doing?
Well, I guess, yeah, we could see if they're going to be in session or not. I guess well, obviously when we're on this call next week, we'll know what happened on Tuesday. So,
Correct.
well, hopefully, because I have a feeling it's going to drag, but hopefully we'll, at least in Illinois, I guess, know.
Yes.
So Peggy, do you want to create an event page for that just so it's up?
Yeah, what day is it's the 17th? Is that what you say, Carrie?
Yes.
If you don't mind creating that.
Yeah, I can do that. What day is that? It's a Tuesday.
Mhm.
Sunday, Monday, Tuesday. I mean, we could get lucky, and sometimes in November you get
Right.
weather isn't,
Because theirs is okay. The representatives are tentatively the 17th. Thanksgiving is the 26th. So the senators, I believe then, if I understood what one of the senators told me, I believe they go back, if they go back, the 30th, 1st, and 2nd is what I think they said.
I'll pull up that page. Hold on a second.
Right, because I know the representatives go before Thanksgiving and the senators go after. Tammy, since you live in Springfield
Mhm.
and all the rest of it, if it looks like this is going to be a go, any chance you can find a crowd to bring with you?
I don't know. I'll try. Yeah, I'll try.
Okay.
And then,
I was correct. So I was off by a day on the Senate, but
oh, did that show both of them? I'm sorry.
you're fine.
I couldn't remember. And then here's the other one. Oops. I'm probably giving you the wrong things. Oops. Sorry. Weird.
Maybe it would be good to let the legislatures we know, like you said that, Carrie, you mentioned two names that said they would, I guess, basically sponsor a legislative thing, like to connect them all, or I can send Mike an email and let them know again who they were, but I don't remember who you said.
So we know that, okay, so we have Jill Tracy, Chaplain Rose.
I'm sorry, what was that name again?
Chaplain Rose.
Chapin.
Chapin, sorry.
Dave Severson, Charlie Meyer, Dan Calkins, and Terry Bryant. and Brad Hallbrook have all been ones that have been on the Zoom even.
Have they said that they'd be willing to sponsor, you think, or not?
So Terry has, Charlie has, and Jill has. Those three I know for sure. Also, Dan Calkins is another one. Did you give her that one?
And that's what I said that.
Okay. Sorry, I was responding to one of the nurses.
That's fine.
I just think we need to get them all connected together.
Yeah, that's what I was
Right.
thinking too.
One of the things we need as they move forward and work towards essential caregivers is to make sure that everything, they understand that we're asking for these things to be written as a mandate. You know, that the facilities will be required to participate.
Well, yeah, see, that's what I'm afraid of when IDPH comes out with their
Right.
essential caregiver is it's going to
They're
just
going to
be,
model it.
yeah, well, it's just going to be like a guideline and nobody's going to, you know, no one's going to follow it.
Well, Deborah, on all the different pages, the lady who gives everybody too much information, you know, the really long posts, she posted something this morning, and I'll have to go back and find where she posted it. But she posted an email that was sent from like National Consumer Voice magazine, and a bunch of different advocacy places to CMS prior to the September 17th guidelines. And in this letter, that's what they very clearly said. This needs to be a mandate because facilities are going to opt out otherwise. So let's also, I will go back and track that one because and send it to you, Jennifer or Tammy, because you know, that in itself is a really good justification of bye, Stephen. Yeah, I think that's what Fran is posting right there, I think is it.
Yeah, I'm just going to post the link to the, that was at the bottom of that
Okay.
and into the chat. I'm trying as we go along just to post links for everything about which we've discussed. So you just have to go into the chat and pull it out and copy and paste it. This one.
You said
Terry.
there's a way to save the chats when we're done, didn't you, Fran?
Yeah, I save them.
Okay. Well, that's what I'm asking is like, how do I do that?
I don't know if you can.
Yeah, you can. Anybody can. So,
Yeah.
Well, okay. No, I don't know if I have it enabled. How does that sound?
Well, it says on where you would put a comment, there's little dots and then save chat.
Okay,
Yeah.
then I enabled it. I didn't know if I allowed everyone to do
No.
it. Is
Okay,
all I'm
cool.
saying. Not that I don't want you to. It's just
when
I
you go to
didn't
the
know if it was enabled.
and it says like to everyone, and then your file, and then more.
Yeah,
And more, and it'll say save chat.
right. That'd be very helpful for me. Hey, Jennifer, are you still seeing your parents?
Yeah. I'm gonna go there this weekend.
Do you think I know you said your mom is more communicative than your dad and stuff. Do you think you could video asking them questions of what this has been like?
Yeah, that's what I'm planning to do. But if anybody has some thought starters of what I could say to them, because sometimes that, like I said, they're not very.
So I've done things with Lynn like asked him how long he thought this has lasted. Obviously my son and time don't always equal, but and when it started, and even now the majority, what are they making you do? You know, and his response is that we're locked in my room 24 hours, you know, things like that. Fran, what kind of questions did you ask Luke?
I'm actually gonna share just a brief little bit of what
Okay.
I did, just so you can see it. We were driving and I just allowed him to, I just asked him questions. Do you want to go visit this one? Do you want to get to go visit your home? Yeah. Does it make you sad you can't go home? Why can't you go home? Has it been a long time since you've been home? Has it been really? Yeah. Has it been a long time since you got to go home? Long time? Yes. What do you miss at home? My dogs. You miss your dogs? Yeah. What else do you miss? My cat.
So anything you get, Jennifer, works. You know, because all we're going to do is piece things together and show them, try to make them cry, I guess. We've got to show them something that's going to get and pull their heartstrings. So I don't know what other way to put it.
I put it as just being real.
I agree.
Yeah.
Just be real and go with it, and just record, because we can always edit, but it's more just about just being real.
Right.
Because yeah, he said no, but he wasn't, he didn't quite understand all of it, so
Right.
that was kind of the gist of it. Oh, by the way, I'm gonna stop recording now.
That's fine.